Well, recent studies have revealed widespread bullying and sexual harassment of junior doctors and medical students. It's just one of the issues plaguing New Zealand's health education sector at present. And New Zealand Medical Students Association President Elizabeth Berryman of Dunedin is here to tell us more. Good evening, Elizabeth.
Good evening, Callum.
So, how commonplace is bullying for medical students?
Well, we've known about bullying as an issue for the past few decades in the medical profession. So, as an association, we decided to do a survey of our 4th, 5th and 6th year medical students. And the results showed, surprisingly, that 54% of our students have been bullied in the medical workplace.
So is this a new problem?
No, it's something that we've known about, and that's why we did the survey. The Resident Doctors Association also did a survey of junior doctors showing a similar rate of bullying as well.
Are we seeing this, is this worse than before?
No, it stayed the same, but this is the 21st century, and bullying and sexual harassment in any other workplace is not tolerated, and it is so surprising that it's tolerated in a medical profession.
So when you say harassment, what type of harassment are these students facing?
So they're facing verbal harassment, people being yelled at, people being told things about them personally, so like their clothing or the way that they look and dress, and also, surprisingly, those stories of sexual harassment, which is really sad. So
what's your association doing about it?
Well, we're working with our neighbours in Australia, the Australian Medical Students Association, as this is an international data, is about 50% of medical students have been bullied across New Zealand and Australia, and we're working on policies. We're also working with the medical schools. At the present, only 11% of students feel that they're able to report if they've been bullied, so we would like to work on an anonymous system. We work under an apprenticeship model, so that means that people that are potentially the bullies are actually the ones marking our grades, and so this is a reason why students aren't saying, reporting it to the medical schools.
So this is a problem nationwide. What about locally here for students in Dunedin?
Sure. So our survey showed that Dunedin Hospital has got the same rates of bullying as other places in the country, and the Otago Medical School has approached us, which is really exciting, and we're working with them on some new policy and some new culture changes in the workplace. And we're also working with the Medical Council, as this is an issue of professionalism, and looking at some ways that we can do that in the profession.
So what other concerns and worries affect medical students? I guess student loans would be up there?
Yes, yeah, we've got a high rate of student debt because we study for 6 years, and in 2010 the government brought in a policy that meant that we can only have 7 years of student loan, and for 30% of our class who come as postgraduates, that means that we've done a previous degree. So myself, I've done a 3-year nursing degree before going into med school, so that means we're going to be over the 7-year limit and need to get more funds for our student loan.
So what would you like to see done about this?
We'd like to make an exemption for medical students because we are the longest degree, which is 6 years, and of course 30% of our cohort have done a previous degree, so about 125 students will be affected per year.
What about graduates staying in New Zealand? Are we seeing enough numbers retained here in this country?
Yes, yeah, we actually are, which is surprising because we used to have a lot of people going off to Australia, but now it's the other way, and some Australians are wanting to come to New Zealand. So it's really good that the government has worked on those issues and sorting out our health workforce planning.
Is your association lobbying for any other changes at the moment?
No, our big ones are, of course, the 7-year limit, as that is directly affecting our students, and the mental health and wellbeing issue. That's how we came about with the bullying and sexual harassment survey, is because we realised that that was impacting the wellbeing of our students.
All right, Elizabeth, thanks for your time this evening.
Thank you, Callum.